Hi everybody, I am Thatnursingprof and welcome to my channel. In today's video, I'm going to be teaching you a mnemonic device to help you with your assessment of the patient experiencing delirium. So let's get into it. So the first thing you'll notice is the mnemonic device is the word delirium, which is really nice. It's a really nice way for you to remember these things. So starting with the first one, the D stands for drug use. So you want to assess the patient's medications. Things like, are they currently on sedatives, antidepressants, opioids, those sorts of meds? Has there been a change in their meds at all? Like an increase, a decrease, a change in the frequency, a change in the brand, that kind of thing. So you want to assess their medications. E is for electrolyte imbalances. So magnesium, calcium, things like that. Electrolyte imbalances can cause delirium. Malnutrition, dehydration, so assessing for signs of these things in your patient. L is for lack of drugs. So maybe they're not taking their drugs appropriately. Maybe they've missed a dose and it's caused this situation to occur. It's caused these signs and symptoms to start happening. I is for infection. This is a big one. This is a big one we see especially in the elderly patient. So your patient could have no cognitive impairment. They could be perfectly healthy otherwise, and then they get a UTI and now they're acting like a completely different person. So this happens a lot. So checking for things like infection, specifically UTIs and respiratory infections. R is reduced sensory input. So this can include things like decreased vision, decreased hearing, so any sort of sensory impairment. This can also include things like social isolation, so they're not getting enough stimulus from those around them. So think about your patient who's maybe on like isolation precautions. They are at higher risk for delirium because of that. I is for intracranial problems, so anything that's affected their head, especially recently. So like a recent head injury from maybe like a fall, or a recent stroke, meningitis, things like that. U stands for urinary retention / fecal impaction. So things that can cause urinary retention, BPH, which is common in the older adult man. Catheter removal. So if they've recently had surgery or they've recently had an indwelling catheter, sometimes after it's removed, people can experience retention. And then recent exposure to any sort of anesthesia. Maybe they've had a procedure or a surgery recently. And then the last one, our M, is myocardial problems. So anything with the heart. So that can include things like angina. They can have an abnormal EKG, not enough oxygen and blood flow to the heart. So these are things we want to assess our patient for that's experiencing delirium, because delirium has a physiological cause, usually one of these things, right? And if we can figure out what it is and we can treat it, then they can get better. So this was a quick little video, but I thought this was important and a helpful tool for you. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.